Okay, so listeners sent in some info on this Dr. Zheng Yaoxian,
Hmm.
endocrinologist, right?
Okay.
And want us to give him the full deep dive treatment.
Okay.
And buckle up, listeners, because
Mm.
this one's got me kind of hooked.
Yeah.
We've got this like super formal bio, all the titles, the dates, the whole 9 yards,
Right.
and then bam, out of nowhere, there's this Facebook post, and it is surprisingly human.
Interesting.
It's like we're getting this little peek behind the curtain.
Yeah, I see what you
It
mean.
makes you wonder, right?
Definitely, definitely. It really highlights how we form these impressions, even with limited info, right? You've
Yeah.
got these pieces seemingly totally different, a formal bio, a personal post,
Yeah.
and our minds just automatically try to fit them together, create one coherent image.
It's like solving a medical mystery, but the patient is the doctor himself this time.
I like that.
So where do we even start with this, Dr. Cheng? Give us the basics. What do we absolutely know?
Well, let's stick to the concrete details for now. Dr. Cheng, he's currently the director of endocrinology and metabolism
Okay.
at Tung's Taichung Metro Harbor Hospital. That's in Taiwan.
Okay.
And that title alone, that's a pretty impressive title. It
Yeah.
suggests he's, climbed the ranks. He's in a position of authority in his field, not just any endocrinologist.
They're not just any hospital either, right?
Exactly.
I was doing a little research myself, like our listeners do.
Always a good idea.
And Tung's Taichung Metro Harbor Hospital, that's known for top-notch care,
It is.
especially in endocrinology. So
Yeah, you're not wrong.
we're not talking about just anyone here. This is a big deal.
Precisely. And his background, it supports that too. He was previously at Taichung Veterans General Hospital, another indicator of a very, very strong medical background. Clearly, he's worked his way up, honed those skills, earned that respect from his peers.
Okay, hold on. Rewind for a second.
Yeah,
Did you say he also has a PhD?
I did.
Because I'm looking at his bio right now, and wow, talk about going above and beyond. This isn't just, doctor. This is like doctor.
Right. It really makes you wonder what he even researched for that.
It does. A PhD on top of med school. That says something.
Definitely not the easy route.
Definitely not. Okay, so we've established that Dr. Cheng is a bit of an overachiever.
Safe to say.
But tell me, what does he do? What does an endocrinologist even do?
Okay, so Dr. Tseng mainly deals with diabetes, hypertension,
Okay.
high blood lipids.
Right, the usual suspects, we hear about those.
Right, the usual suspects when it comes to endocrinology. And this is where it gets interesting.
Ooh, I like interesting.
There's mention of him handling, and I quote, other endocrine disorders, including less common ones.
Okay, so he's not afraid of a challenge then.
Seems not.
He's cool with the everyday cases, but also ready to tackle the weird stuff,
Likes a good mystery.
like a medical Sherlock Holmes.
No, there's an apt comparison. It does suggest a mind that, really enjoys that problem solving, right?
Yeah.
Piecing together those clues, finding the answers where others might not.
Speaking of clues, something in this Facebook post, it really stood out to me. It says, and I'm going to try to say this right, it says basically he carefully provides patient education.
Interesting.
And I know, on the surface, that might not seem like much.
Right.
But to me, that small phrase, it speaks volumes.
I see what you're picking up on there. That phrase, it hints at a very specific approach. It's bigger than just diagnosis and then writing a prescription.
Right.
This suggests Dr. Tseng really cares that his patients understand their own health.
Exactly.
It's about that investment in the patient themselves.
He's not just throwing prescriptions at them and saying, see you later. He's taking the time.
He's present.
He's present. He's explaining things, making sure they can make good decisions about their own health.
Absolutely, it's about empowerment.
And you know what? That actually connects perfectly with this other little tidbit I found about his support for something called cognitive behavioral therapy.
Now that is fascinating, and maybe it's a good place to pause for now.
Oh, cliffhanger.
A little cliffhanger. We'll dive into exactly how that all works and what it means for Dr. Tseng's approach right after the break.
All right, so before the break, we were talking about Dr. Tseng's approach to patient care.
Right.
And you mentioned cognitive behavioral therapy.
I did.
And I got to say, I'm all for like a holistic approach and all that.
Of course.
But that term, it kind of makes me think of, I don't know, mood boards and meditation apps and stuff.
Right.
What does that have to do with, actual endocrinology?
That's a fair question. It's easy to assume those things are totally unrelated. But it seems Dr. Tseng is making a connection here. So, Cognitive behavioral therapy, CBT for short. It's about identifying and changing those thought patterns,
Okay.
those negative behaviors that might be contributing to a condition.
Gotcha.
And yeah, you're right. It's often used for things like anxiety, depression.
Yeah.
But in this context, in endocrinology.
It's about how our brains are impacting our bodies.
Exactly.
Like if I'm stressed all the time and I'm, stress eating a whole bag of chips,
Right.
that's going to mess with my blood sugar,
Yeah.
right? It's all connected.
Precisely. And for conditions like diabetes, a lot of times it means making some big lifestyle changes.
Yeah, for sure.
And CBT can give people the tools, the strategies to actually make those changes last.
So it's empowering.
Exactly. It gives the patient that control over their own health.
Okay, so we're seeing a pattern here, right? Patient education, this CBT thing. It's like Dr. Singh, he isn't just treating, like, symptoms.
Right.
He's treating the whole person,
I like that, treating the whole person. And it makes his research even more interesting, don't you think?
Oh, totally. Because you're not just a doctor at that point. You're like a medical philosopher or
It's a
something.
medical philosopher. I like that.
Got to coin that. Trademark. Okay, but seriously, his research,
It's pretty deep, pretty fast.
it does. We're talking diabetes, obviously.
Which makes sense, right? Given his specialization.
Right. But then there's cancer research, too.
Mm-hmm.
And wait, what was that other thing you said earlier? Something about
Pharmacoepidemiology. Yeah, it's a mouthful.
It does sound kind of like a medical thriller,
It has a certain ring to it, doesn't it?
It does. So break it down for me. What is that?
All right, so imagine like a medical detective, right?
Okay, love it already.
And they're piecing together these clues about how drugs really work out there in the real world.
Ooh, in the wild.
In the wild. That's basically pharmacoepidemiology.
So it's not just like what happens in a lab setting.
Right, it's bigger than that.
It's about how medicine affects actual people with all our, messy human stuff going on.
Exactly. It's about seeing the full picture, the long-term effects, the unexpected side effects, the things you just don't always catch in a controlled environment.
Okay, yeah, that makes sense. But help me tie this back to why our listeners should care.
Okay, so think about it this way. Dr. Zung's doing all this research, diabetes, cancer, this pharmacoepidemiology.
Yeah.
It suggests his mind is always going,
Always searching.
always searching for new knowledge, new connections.
So he's not just like coasting on what he learned in med school however many years ago.
Not at all.
He's keeping up with the latest, the greatest.
Exactly.
So if I'm his patient, that's reassuring, right? Knowing your doc is on top of it.
Right, they're not stuck in the past.
It's like having a doctor who's also a little bit of a medical futurist.
I love that. A medical future.
Trademark. No, that one's all yours.
Okay.
But it's funny. This whole like delving deeper, connecting the dots thing,
Yeah.
it even shows up in his hobbies, which is wild.
You're right. It's like this thread that runs through everything.
So we see he loves reading, which, okay, fine. A lot of doctors are bookworms.
Comes with the territory, right?
Right. Got to stay sharp and all that.
Yeah.
But then there's like golf. Okay, strategy, precision, I get it. But programming, that one came out of left field.
That one definitely stands out.
Was there something specific about that in his bio, or are we just riffing here?
No, you're good. You're good. It wasn't like analyzed or anything in what you said.
Okay, good.
But it's definitely noteworthy. Think about the type of thinking programming requires.
Okay.
It's analytical, it's logical, it's detail-oriented, very specific.
Right, you're basically building systems, right?
Exactly. Solving problems with code, not your average way to unwind after a day of seeing patients.
So are we saying that knowing how to code makes you a better doctor? Because that's a connection I haven't made before.
Not necessarily, but it does make you think.
Right.
It suggests a mind that's comfortable with complex systems.
Right, breaking things down.
Exactly, breaking things down into those manageable steps. And, maybe, just maybe, that translates into a more, data-driven approach to medicine, seeing the patterns, connecting the dots, just like you might when you're, writing code or looking at research data.
Okay, yeah, I see it. I'm starting to see it. So it's like, okay, imagine Sherlock Holmes, right?
Always a good place to start.
But he trades in his magnifying glass for a stethoscope.
Okay, I like it.
Right? Instead of solving crimes, he's solving medical mysteries.
That's a powerful image. And it gets at something we talk about a lot on here, the importance of holistic perspective.
So, okay, we got this picture of Dr. Tang, right? He's top of his game, endocrinology, but then there's also this whole other side.
Right, it's not just the what he does, it's the how,
Right, exactly. Like, he gets that Just treating the disease isn't always enough.
And that's where all these other things come in. The patient education, the CBT. It's about seeing the whole picture, the person.
Like he's saying, hey, I'm not just here to manage your diabetes. I'm here to help you really live with it.
It's about thriving, not just surviving.
Yes, and honestly, that's huge. You don't always find that.
It's something to really value in a doctor, that's for sure.
Especially when we're talking about something as complex as, well, any health issue, really.
Right, but these things, diabetes, even cancer, it's ongoing.
You want someone who's not just the expert, but who's in your corner,
A partner. Someone who's going to be there for the long haul.
taking the time to listen, to explain things clearly so you feel empowered.
That's what it boils down to, making the best choices for your health.
And it sounds like, from what we've gathered, Dr. Tseng might be that guy.
He certainly checks a lot of those boxes.
He does. But, at the end of the day, this is a big decision.
Absolutely. Who you trust with your health, that's personal.
It is. And look, we can analyze, we can connect these dots, offer up our thoughts.
And we hope that's been helpful.
We do. But the most important thing is, our listeners have the tools now to ask the right questions.
Exactly. Because a deep dive like this, it's not about handing you the answer.
There's not always one answer, right?
Right. It's about sparking that curiosity.
Getting those wheels turning.
So you can make the most informed decision for you.
So listeners, here's something to think about. When it comes to your health, what matters most? And does Dr. Tseng, with everything he brings to the table, the expertise, that empathy, even that hint of the unexpected, does he sound like your kind of doctor?
That's the real question, isn't it?
It is. And on that note, this has been another Deep Dive. Until next time, everyone.